In cases in which we have peg-shaped laterals, like in this one, we have to be very careful when we are planning its movement, because since the surface of contact in between the aligner and the tooth is going to be reduced because of the size, the movement might not be expressed as well as in a regular lateral. Like in this case, it would be the upper right would be a normal size and shape, and the upper left would be peg shaped. In these cases, we're going to check the bolt-on analysis, which we usually have from clear aligner manufacturers. So we see it's almost 2 millimeters difference in between these two. And we are going to create some space. First of all, as we see, there is a negative torque in the four anterior incisors, and therefore we are going to procline them. To create some disocclusion in this case, to allow the lower growth and solving, we're going to have precision ramps. But this is really important. We're not using precision ramps in these peg-shaped laterals. Why? Because they would be reducing the surface of contact, since there is a gap inside this precision bite ramp. We wouldn't be using either, even if the system, the algorithm, or the CAD designer allows us to do it. We wouldn't be using power ridges because they will probably increase the misfitting issues we might have during the treatment. What we will be using from the very beginning is an optimized, or if we don't have optimized attachments, a conventional one, because they're going to be helping us to increase the surface of contact and therefore reducing the lack of misfitting. And this is important. We have it from aligner number 1. Otherwise, we shouldn't be performing any movement on this. So, as you can see, first of all, what we are doing is procline the crowns. We're proclining the crowns without root movement. Then we're planning some intrusion and retrusion of the anterior segment. At the end of the treatment, we will carefully select the spacing we have in between these two and the two adjacent to make sure there's plenty of space for its restoration and give it a normal size and shape. It is quite important that this space is being created from the very beginning. From initial stages of the treatment, we are creating this space because this is allowing to reduce the conflicts, the collisions in between these two and the two adjacent, and make sure that the movement is going to be perfectly achieved at the end of the treatment.